I present a case of Kartageners syndrome affecting a patient in pregnancy managed at Queen Charlotte's in Chelsea Hospital this year. Kartageners syndrome is a subgroup of primary ciliary dyskinesia affecting a population of 1 in 30,000, and hence it's a rare condition that's encountered by very few obstetricians in pregnancy. This autosomal recessive condition affects cilia structure and biogenesis, resulting in chronic respiratory infections, fertility issues, and disorders of organ laterality. We describe the case of a 25-year-old woman in her first pregnancy that was managed through the obstetric medicine service. She was initially diagnosed with situs inversus at birth, and it was not until the age of 9, following recurrent ear and chest infections, that she was formally diagnosed with Kartageners syndrome and was being managed at the Royal Brompton Hospital in London. This was confirmed with genetic testing, and prior to getting pregnant, she had a 2-year history of infertility. She was in a consanguineous relationship, and other members of her family were also affected. In her pregnancy, she completed all the COVID and influenza vaccines, and she was able to self-manage the Kartageners syndrome with home spirometry and daily chest physiotherapy. She was using saline and steroid nasal sprays regularly and also had a rescue course of oral antibiotics, which she did not require. The maternal echocardiogram and lung function tests performed in the pregnancy were very reassuring. A plan was made for her to have early regional analgesia to avoid a general anesthetic. The concern with a general anesthetic would be an increased risk of chest infection, atelectasis, and iatrogenic pneumothorax. She went on to have an uncomplicated term vaginal delivery of a healthy male infant. Treatment for primary ciliary dyskinesia can be extrapolated from other chronic respiratory airway conditions such as cystic fibrosis, and with careful management with a multidisciplinary team, an uncomplicated pregnancy and delivery is achievable. I have noted the references that I have used for this poster presentation. Thank you.